Thank you very much, Father Anthony and Brother Ken, for this opportunity, for giving me this opportunity to come and give a presentation about a Muslim view of what has happened with the coronavirus pandemic and what has been what is the Muslim understanding of the coronavirus and their responses. I dedicate my presentation today to Father Eilers, with whom I had a long communication and friendship, and we miss him here this evening. So having said that, what I would say in the beginning, that Islam, like every other religion, talks about health and well-being, including the indigenous religions. So all religions offer a view of health and well-being, or which leads to happiness and to welfare and healthy society and healthy individual. But unfortunately, we in our modern age, or the age of the Anthropocene, we have seen the rise of a desacralized approach to life, desacralized approach to science, and this has affected. It has affected all of us. The coronavirus has not only affected a particular community in China, but it does not discriminate, and thousands of people, millions of people have died, and thousands are in hospitals, and all are suffering. As the Buddha says, there is a cause for suffering, and we have to find out what is the cause for this suffering. And the cause of this suffering is the human being. In a way, I would say that the human being is responsible for bringing this coronavirus on itself. And this reminds me of what the Quran and Islam's view about this is, or what is the Sharia view. When I use the word Sharia, I want to use it in a way that you don't get frightened of me. Whenever the term Sharia is mentioned, people think about cutting of hands. The Sharia talks about hudud. Hudud means the limits beyond which the human being should not go. Or if the human being goes beyond the certain limits set by God, that leads to imbalance, injustice, and suffering of different types. And we have been seeing that since 1990s, there is the ecological crisis, the environmental crisis, and the COVID-19 and coronavirus is a part of that human indifference and human behavior, which has brought this pandemic on all of us. I remember when I was teaching in Assumption University in 1990, the Kyoto Protocol was agreed upon in regard to climate change, but the big countries refused to accept the protocol, to approve the Kyoto Protocol. And now, recently, the famous natural historian Sir David Attenborough, in an article 2 years ago at the Davos conference, said that Garden of Eden is no more. We have all landed ourselves into this age of crisis, of global ecological crisis. And just 2 or 3 days ago, in the Glasgow conference, where all the national leaders met, they agreed to address the change in the issue of climate change. But they are mostly making pledges. And again, Sir David Attenborough said that we have to work cooperatively together to address the pandemic as well as the climate change. Now, from the perspective of the Quran, the scripture of Islam, it talks about that God has created the whole planetary system in a state of balance, or what the Arabic word is mizan, and it calls upon the human being not to upset the balance. It says all the scriptures, all the prophets have brought about the message of mizan, or balance. But when the human being rebels against the balance and they upset the balance, this is when humanity brings suffering onto itself. So the balanced approach is very important in personal life as well as social life, communal life, and now also at the international level. We all are affected. Since last 2 years, I have not been to the mosque because I don't trust that the person next to me is a COVID carrier, is a virus carrier. Mosques have been closed. The Muslims have not been able to go to Hajj, the pilgrimage, and I will come to that more later. The Prophet Muhammad sallallahu alaihi wasallam, peace be upon him, said that there is no disease that God has created except that He has created also its treatment. But we do see that even within the religious tradition, whether it is, as mentioned by Dr. Cohen, and I would also say among the Muslims, there are people who support, majority who support the taking of vaccine, but there are also anti-vaxxers who say that God will, we leave it to God and God will set, whether that comes to us or not, it is God's will. This is a sense of irresponsibility from the perspective of Islamic view of human being as being a vicegerent of God on earth. And Prophet Muhammad also, during Prophet Muhammad's time and also during the early age of Islam, there were five plagues. And there's a saying reported from Prophet Muhammad. He says, if you hear an outbreak of a plague in a land, do not enter it. But if the plague breaks out in a place while you are in it, do not leave that place. This is basically the idea of quarantine. The famous Muslim philosopher, scientist, mathematician, geographer, and a medical doctor, Avicenna or Ibn Sina of the Middle Ages, who wrote the book The Canon of Medicine, a very important book. He had discovered through his study of disease that there are the spread of microorganisms from causes human to human contamination. And he came up with a method of isolating human beings for 40 days, and which in Arabic is called Arabiyin, which the idea of quarantine has been drawn from his work in his book Canon of Medicine. I will not go into detail about him, and I'll come directly to the issue which we are facing today. So there are religious and metaphysical dimensions to the coronavirus and the pandemic, and it has affected religious communication within intra and inter-religious societies. We all are affected by it, and this can only be addressed through religious communication, which leads to religious solidarity in addressing the interests of all the groups and all the societies across the world. And this requires us of studying the source of medicine and how to address this challenge of the coronavirus and the pandemic, which I see as is not coming to an end any soon. We have seen, and it is very interesting. I teach comparative religion, and it have seen, and I was just telling my students the other days that religious festivals have now become the super spreaders. You see, now we are celebrating every religious festival or every religious event in which the community engages without observing, in spite of being communicated by the national leaders and the medical leader and the health workers and the doctors, that you have to practice the SOPs or the movement control measures. Yet religious festivals and events have become the sources. I just was telling my students, for example, when we have the Eid, the Muslim festival, when we have the Deepavali, when we have the Christmas, and when we have the Chinese New Year. So it is going to be round circle of the spread of the increase of the numbers. For example, in Malaysia, recently, after the end of Ramadan, the numbers of daily infections were going up to 20,000, and the Malaysian government had to put in strict lockdowns, and also encourage, and the religious leaders in Malaysia had to ask the people to go and get vaccine. And Malaysia initiated a program of rapid vaccination. So today the numbers are down to 3,000 new infections per day. Because of the strict restrictions which were put on movement. But I'm sure as another religious festivals come in, religious events takes place, it doesn't matter which religion it comes to, the numbers will go up. I'm saying this in a way that I'm saying that unless and until the human being does not understand their position on this earth of which we are, and our responsibility, not over to ourselves and being selfish, but to the whole humanity, the suffering will not end. Muslim scholars, Muslim jurists, and Muslim scholars of Islamic jurisprudence have taken have made fatwas or opinions encouraging Muslims to promoting vaccination for social good, for common good of everybody. For example, because now if you as it happens that attending of Friday prayers is limited to numbers. This is something what Dr. Cohen was talking about, and similarly to him, to what he was talking about. And everybody has to bring their own prayer mat. And now we have to show that we are fully vaccinated. We should carry our digital certificates when we enter the mosque. And then the mosque doors are closed immediately, and the prayer is conducted very fast so that there is not it does not extend, and immediately the mosque is closed after the service is over. Similarly, so there's a lot of screening going on, not only in the public place but also in the religious place. In the Mecca, the Hajj or the pilgrimage to Mecca has been limited or restricted by the Saudi Arabian government. Normally, 2 million people come to attend the Hajj every year, but since last 2 years, it has limited only to Saudi Arabian citizens, because Saudi Arabia does not want to make the Hajj as a religious ritual which will lead to suffering of humanity. So COVID or pandemic, the pandemic does not discriminate between religious communities. It has also affected the funerals. The people who have persons who have died of COVID has affected the funerals. They are limited. The attendance of I've seen some of my friends and my relatives pass away, and they say that this is a COVID funeral, so please don't come and don't join. So this is what has and the prayer, and people are now said to pray from home or that rather than going to the mosques. So it has affected, as I said, the funerals and the handling of the dead bodies, and the ritual for the funeral has also been affected. So religious communication plays an important role. Now, as we see, I'm talking from giving the examples from the Muslims, but also that there are examples from other religions where it has affected every community. But at the same time, some of the governments are not sensitive to the religiosity or the religious sensitivities of other religions. For example, in Sri Lankan government, it had mandatory that all the people who died from COVID should be cremated, and it affected the Muslims and the Christians of Sri Lanka because they don't practice cremation, but they practice burying of the dead. So finally, the Sri Lankan government had to change its ruling. So in this sense, interfaith understanding is very important. Let me end here by saying that the life we lived before the coronavirus, before the pandemic, was a life full of excessive materialism, consumption, and which was going on. You would see the airports were filled. The people were traveling from all countries. Everyone was busy. The Air Asia was busy. Everyone was flying, and there was no limit. We had forgotten our own role and our own place on this earth. So we landed up in this situation because of our own misunderstanding of what the role of human being is. And then there is also, as Dr. Cohen has mentioned and others, that about the discrimination which has taken place in regarding to the sharing of the vaccine. The poor countries, especially the African countries, are suffering a lot, and yet the availability of vaccination is very, very limited, to African countries because they cannot afford. So this kind of, while there are countries which are hoarding vaccines or throwing away vaccines which are expiring very fast, and this calls for us. This calls for again the role of communication between the governments, between the religious bodies, between the religious communities, and also the rich and the poor countries, the North and South divide. So my last few comments here is that from the perspective of Islam, we have seen that in the case of Muslim countries, there has been a cooperation taking place between the scientific community and the religious community, though there are some who reject to be vaccinated. But what is needed is a collaboration and collective effort in addressing the question of addressing the pandemic era, not only now but also after the end, because the whole of humanity is suffering. It really brings me to tears to see how the whole of humanity is suffering, and we have to change our ways of our life. And it is there where the Quranic teaching of mizan or balance is important. We need to have a balanced approach to life, a balanced approach to environment, a balanced approach to society and interhuman relationship, so that I hope that we can have a new kind of humanism, a humanism where religion, science, secular or believers or non-believers understand through this great suffering which all of us are going through and has not ended. And even now, I am teaching most of my courses online. My students in America, I teach at 5 p.m. here in Malaysia, but my student in America has to get up at 4 a.m. or 5 a.m. in the morning just to attend to my lectures. And this is kind of suffering which is global. So it is time that we realize that we redress ourselves and redress the situation and redress our understanding of the role of human being in this planetary system. Thank you very much.